First up, though, let's talk to Dr. Tony O'Sullivan. He's co-chair of Keep Our NHS Public, a campaign group. Good morning to you.
Good morning, Julia.
Thank you so much for joining us, Tony. I'm going to go out on a limb here and guess that you are supporting junior doctors, and there will be, as we've seen, a lot of support for doctors, as there has been for nurses and some others going on strike. Everyone's facing the cost of living crisis, and we'll understand why people want to make sure they get pay that goes up in line with inflation. Doctors, though, asking for 35%. Do you think they've over-egged the pudding there?
Well, I'm not speaking for the BMA. I'm speaking as a retired consultant paediatrician, but I've lived through the last 13 years. This is a very, very serious situation, the most serious situation facing the NHS and the population in my professional lifetime. And we've just got to ask the question, who is responsible? It's a really serious moment, and we can't just use it to attack one side or the other. We have to ask, who's been in charge for the last 13 years that has allowed us to get into this position? And it is an incredibly serious decision that the BMA have taken. They have not taken it lightly. There was a study from Leeds very recently reported of hundreds of hours of junior doctors' diaries of their concerns day to day through the hours of their shifts. And their top concern was not actually pay. It was concern about having far too many patients to cover with gaps.
Not being able to do their job properly. But you say who's been in charge the last 13 years? Yes, it's been a Conservative government, an elected government in charge. And yes, there were austerity years, although the NHS budget went up, but perhaps not in line with the extra needs of an ageing population. Or take all of that aside. The answer to that question, who's been in charge the last 13 years? Well, the NHS bosses. We have a heck of a lot of people running the NHS, a heck of a lot of people on six-figure salaries running the NHS. We've got different layers of management all the time. Is there not a huge amount to blame on those people? Because right now, and for the last few years, the NHS has been awash with cash. I mean, you can't move for cash, and yet we're seeing the thing where we don't have enough money to pay doctors and nurses, but we do have enough money to pay nurses from an agency bank, 3 times as much for the same shift. We can pay diversity officers and net zero officers and send everyone on utterly ridiculous sort of critical race theory courses, but we can't afford to give a pay rise to to the porters. I mean, the people who've been in charge the last 13 years are the NHS chiefs. Aren't they to blame?
Well, I've heard you say that before, and you've heard me reply in kind. It is not an issue about NHS management.
It's not an issue about NHS management.
Hang on, let me just get a word in. You know yourself that the NHS as a public service is run by the government. You know that the pay review body is actually dependent on the allowances that the government gives. You probably also know that the NHS, as a huge organisation of nearly 1.5 million people, is one of the proportion of management costs in an organisation of that size is one of the lowest in Europe. In fact, it's easy to pick out high figure salaries, but it's the wrong time to be trading such trivia in a way.
But my point is, it's not trivia, because something like 40% of the NHS workers are not actually involved in medical care. Now, of course, they're going to be cleaners and people making the food, and you need people who are going to be doing the admin to get people in, get people out. Of course, I'm not pretending every single person should be a doctor and a nurse, or radiographer. Of course not. However, there are a huge number of managers, a huge number of paper pushers. There has got to be an issue. You say, the government's in charge. The health secretary doesn't decide how many junior doctors are hired by an NHS hospital. Doesn't decide what shift rota they're on. That's not the case.
But Julie, I'm afraid you're wrong.
They do. Stephen Barclay is deciding if Lewisham General Hospital has got 4 junior doctors on or 6.
Stephen Barclay and, more importantly, Jeremy Hunt, as the Chancellor, are the people that have been holding back the workforce plan for there hasn't been a workforce plan since before 2010. The workforce plan that was leaked recently has shown that the true vacancy rate at the moment is about 154,000. And if the recruitment and retention doesn't improve over the next 10 years, it's likely to climb to something like 500,000 vacancies. Now, it is actually the Chancellor that has to sign off on the costing of a workforce plan. When the government came in 2010, they suspended medical student expansion places and they cut 4,000 nurse training places in 2000. That was one of their first options.
That was, and it was crazy. Yeah, absolutely.
And it was a long time ago, but I'm saying that because, as you know, and we've discussed it here, it takes over 10 years to train a doctor. It takes many years to train the nurses and therapists to the level of skill where they can be independent practitioners in a multidisciplinary team, taking life or death.
No, I understand that. We didn't train enough. I've castigated government ministers about this on a million occasions. But the point is, also let's face it, the BMA also colludes in limiting the number of doctors' places there are in this country for British-born doctors, overseas doctors. Oh, come and pay 40 grand a year. You're welcome to come and train here. But at the end of the day, whether you've got a workforce plan and things, what stopped NHS chief executives doing that?
Because the funding wasn't there.
Funding wasn't there to work out how many doctors and nurses you might need. Are you kidding me?
I'm not quite sure. I mean, you're a very intelligent person, if you don't mind me saying. So if you don't know that you cannot appoint doctors without them,
we're talking about a plan. No, Tony, we're talking about a plan. They didn't even have a plan. It's not like they said, this is how many people we need. And then look, the NHS, the paymasters, the government aren't giving us that. They said, we haven't even looked at how many people we might need in the future. That is an abject failure on the part of the management.
Well, it's just basically not true. I mean, I've been a clinical manager myself. I was director of children's services. We struggled day in, day out to have enough doctors, to train enough doctors, to get them onto shifts. The same for the other parts of the workforce. The Health Education England cuts in training places were because the budget was cut. There was a refusal to expand the necessary. Everybody knew that the population was going up over the last few years by millions. The needs of the population were going up, and the government refused to budge and was consistently trying to cheapen the cost of the public service and to cut the numbers of doctors and nurses in hospital and in the community.
Okay. And all right, I will listen to your personal experience of that. Just finally, Tony, sort of ask you in terms of the advice people have been given. One of the front pages today is saying, don't get sick today or the next few days. What is your advice to people in terms of needing healthcare in the next 4 days?
My advice to people is as a retired paediatrician, be very careful of who you vote for next time. I would say
it's going to miraculously. We all vote Labour. It will be miraculously brilliant and better by 2025.
We need to get a government that actually is responsible for the health service, that is one of the foundation stones of a healthy population and a healthy economy.
Well, hold on a minute. I'm sorry, I've got a guest to get to, Tony. But again, it's this idea that we are not unique in having healthcare free at the point of demand and need for the poorest people. Virtually every Western nation has this, and they have better outcomes.
Well, we've been around this house before, but you know very well that the Health Foundation did a very serious comparative study of funding between the European countries and England, the OECD. and there's £33 billion of cumulative underfunding of our infrastructure, our hospital wards, the ceilings are falling down, the lowest number of scanners virtually in Europe.
Yeah, we've got fewer beds, fewer doctors, fewer nurses. We have, but we spend comparative amounts and we don't get the same outcomes. That's the big issue. Tony O'Sullivan, I know O'Sullivan, we're going to talk many more times in the future, I'm sure, but I really appreciate you joining us. Dr. Tony O'Sullivan, co-chair of Keep Our NHS Public. 7:17 is the time. Do get in touch.